as kids head back to school, it's a good time to take a look at those vaccine requirements for children who attend public schools.
Yes, first, who decides which vaccines are required? And ultimately, that list comes from state lawmakers, the people you elected to office.
Whooping cough, measles, chickenpox, just a few of the diseases you can protect your child from because they are vaccine preventable. The Ohio Department of Health's immunization program targets 17 diseases using a schedule sourced by the Centers for Disease Control and Prevention and monitored with your pediatrician. Jamie Schott says it's all about protecting her children.
Pick a pediatrician that you trust and ask them their advice on topics, and that is the biggest thing that you can do for your children's health is have a provider you trust and listen to them.
Listen and look to the immunization schedule spelled out in a state law for infants through 18 years old. State Representative Beth Liston, who is also a pediatrician, says now in a pandemic, it's crucial that parents have fact-based information.
Ohio is actually a leader in oral polio vaccines, and Alfred Sabin was one of the first to develop the vaccine that we could mass vaccinate, and he's from the University of Cincinnati, so Ohio has been a leader there.
But what about the COVID-19 vaccine? Will it eventually be included as a required vaccine for public school students?
Right now, when we're looking at COVID, obviously it's new and people are trying to figure out what that means for kids and schools, especially as it's fluid in terms of what the risks are from coronavirus.
All COVID-19 vaccines used in the U.S. have emergency but not full approval for people 12 and over. Full approval is anticipated in the coming months. Emergency use authorization is expected in early to midwinter for vaccines for kids under 12. But if it will eventually become part of required vaccines for public school children is still a question at this time.
Some parents, it's as simple as, did you get your kid that vaccine? And we say yes, and they say fine.
Derek McClellan is the pediatric medical director of Central Ohio Primary Care and says now more than ever, he and his team are working to meet families where they are with their concerns about vaccines.
It's really just trying to be that trusted voice for them. That's sort of the beauty of being a pediatrician. You get to see them over time, and you get to build that relationship.
Again, the CDC makes the recommendations on vaccines and the age-appropriate schedule, with the American Academy of Pediatrics working to have lawmakers require them for school. But the full list doesn't change each year. Right now, no state requires children to receive the COVID-19 vaccine for school entry. And Ohio is one of 15 states that allows a philosophical exemption for kids whose parents object to immunizations because of personal, moral, or other beliefs.